Back pain is a common condition. In fact, 4 out of 5 people will experience back pain sometime in their life. So face your pain today at the Spine Center. I'm pleased to say that joining us with more information this morning are Dr. Fred Harrington. Hi, Dr. Harrington.
Morning, Nikki.
Good to have you, and we're also happy to say Dr. Evan Rivers is here. Hi.
Good morning, Nikki.
It's a pleasure to have you both. This is an issue a lot of people deal with. So let's first talk about the services that you provide at the Spine Center.
We're able to provide a wide variety of services to people with back pain and neck pain.
Okay.
Of course, patients will come in and see a physician, but the physician can direct them to the appropriate kind of resources. So we have physical therapy available. We have the right kind of diagnostic testing available through the university. We have multiple professionals in medicine too, including surgeons and physiatrists as well.
And I would imagine to treat no matter what level of pain you're dealing with, whether it's just I had a bad night's sleep or whether there's a serious condition involved, and you can obviously determine that.
Right, and we work closely together. You know, Evan and I consult each other a lot, and
Nice.
there's a lot of that kind of thing that goes on at this center.
Well, I want to ask you this. What are the most common back pain issues that you both hear people complain about?
The most common is pain, and there are probably two basic kinds of pain.
Okay.
One is a pain that radiates down into the leg. We call that sciatica.
Okay.
And then there's another pain where your back is kind of achy and stiff and sore, and we call that musculoskeletal pain.
Okay.
That's mostly what we see, or some combination of that. Some patients actually have a little bit of both.
Okay, so let me ask you this. For people who are dealing with this before they get to you, what can they do to mitigate spinal pain before they come to the doctor?
Probably the best thing to do is to stay moving, incorporate gentle and healthy movement in your life.
Real, and you know, I'm glad you said that because I think people initially think, oh, my back hurts, I better stay in bed. But you're saying stay mobile, huh?
Absolutely, and the problem is when you stay in bed, everything gets tight, and then when you move again, it hurts worse.
That's okay. Is that why when people have surgery or any kind of thing when they're in a hospital, they get them moving within the few hours?
That's one of the big reasons. There are some other big reasons too. But
That makes sense. And obviously, a lot of times we need to get some help for the pain with medication. So what is normally a medication that you would prescribe for back pain?
Well, the mainstays of that kind of treatment is Aleve, non-steroidal anti-inflammatories, naproxen, Motrin, those kinds of medications that you can get over the counter.
Okay.
Tylenol actually is very good as well.
Is it? Okay, because I've always thought Tylenol, but I'm glad you said Aleve because I've heard people question if Aleve is best for your back. So you would recommend it?
I think they're all good, and it varies on the person as to which one is the best for that particular person.
Okay, let's take it a step further though, because there are times where that's just not going to be enough. So what non-invasive treatments would be available to somebody to help?
So we often use physical therapy early on in the course of back pain.
Okay.
And then if that doesn't work, often we'll escalate it to see if there's an injection that might be able to help us figure out what's going on or maybe help the pain problem.
Okay.
And then after that, sometimes it's right to move on towards surgery.
Let's talk a little bit about surgery. I know it's so scary to so many people, especially when you think about spine surgery. How successful is it generally?
Generally speaking, it's quite successful.
Is it?
The important thing is to operate at the right time and on the right person. And I think when that happens, surgery can be a really wonderful experience that can really change a person's life.
And I guess you would guide somebody and say, listen, this is just not the way to go for you, or the opposite.
Well, that's exactly what we think we're trying to do here, is to have somebody come in, and if surgery is necessary, at the right time, at the right place, and in the right order with respect to some of the other conservative cares that Evan was talking about.
Good advice, because you know there are going to be people out there who think it's a simple solution. They say, well, I'll just go have surgery, but that is not always necessary. So I think it's important that they come to you and they get the professional help. So do they actually have to be referred by their, by their general practitioner in order to come to you at the Spine Center?
I think it really depends on what kind of health program they're participating in. So sometimes it's their general practitioner, sometimes it's just some other specialist. Generally, we'll have a referral because we need some information about the patient's health. Yeah.
Well, how can our viewers find out more about the Neurosciences Center?
Well, we have a website, which we would be glad to share with you.
Okay.
And also, the clinic has a phone number, which is 272-9494.
Okay, and what about the numbers that we're seeing on the screen? Are those numbers they can call as well?
Yes, those will also get you there as well.
Fantastic. Both of you, thank you so much, doctors. We appreciate it. We want to keep everybody feeling good.
You bet.
Back is so important, so thank you both.
Thanks.